It's been 2 years since a cataclysmic earthquake rocked the core of the Republic of Haiti, the impoverished Caribbean country that shares the island of Hispaniola with the Dominican Republic. A great portion of Haiti's already fragile infrastructure was destroyed when the 7.0 magnitude earthquake struck on the afternoon of Tuesday, January 12, 2010. Although the quake lasted only 10 to 20 seconds, buildings tumbled like stacks of cards, killing over 300,000 people and forever changing the lives of 1.5 million in and around the capital city. It's estimated that 50% of individuals who are blind in the Caribbean live in Haiti. The priority eye diseases are cataracts, glaucoma, and refractive error. The Caribbean Council for the Blind, CCB, has been working in Haiti for 30 years. In February of 2012, a team from CCB, headed by CEO Arville Grant, visited Haiti.
Yeah, well, you know, we've been around Haiti in terms of our development work since the 80s. And since the mid-90s, we developed a posture that we would do a very comprehensive program here, which includes development of eye health services, development of education services for children who are blind, and development of education of training programs for adults.
Working hand in hand with Sight Savers, an international charity which works with partners to eliminate avoidable blindness and promote equality of opportunity for the disabled in the developing world, CCB is working with hospitals across the country.
We've done significant work with the Ghana Youth Hospital out in the capital of Artibonite. We've done work with the Justinian Hospital in Cap-Haïtien. We're now putting in eye departments here at the Elizabeth Germain Hospital. We're putting in an outpatient clinic and a surgical capacity to do eye surgery. And we're also aiming to do some work at the hospital in the town of St. Mark, which is about two hours drive from Port-au-Prince, Haiti. Here in Elizabeth Germain, we really think it's a good place for us to be doing some work. Pétionville is a mixed community with some very poor sectors of the community and some lower middle class sections of the community. Further up the hill, we have some quite sophisticated housing facilities for the very rich. But we think this is a great place to do a program in Port-au-Prince, and that's why we're here. We're going to be looking at the equipment that we've shipped in over the last year or so. The hospital serves a catchment area of about 600,000 persons, and we think that you know, inside of that 600,000 persons, we should be delivering eye health services quite conveniently and without any big effort to somewhere in the order of 100,000 a person, all of whom should either have something to do with cataract, glaucoma, diabetic retinopathy, those conditions that cause blindness in children, and certainly most of them having some kind of refractive errors requiring spectacles or low vision of light.
Philip Hand is Sight Savers Program Manager in the Caribbean.
The focus is on establishing a vision center in the operating theatre, ensuring we have the right equipment in place to make that happen. We have a lot of equipment here. We need to get it up and running and ensure that it's calibrated, it's the right quality, and that the people at the hospital know how to maintain and operate it. We have been coming here since possibly 2008, 2009, trying to get this initiative up and running. It's been quite challenging. Lots of things have happened, good things and bad things along the way. But we feel this time we're finally at a point where services will be enhanced and new services will be up and running quite soon.
For 60 years, Haiti's Society of and for the Blind, SHA, has been active. SHA is an organization with the objective of assisting the blind and visually impaired. The director of SHA is Dr. Michel Pierre.
We offer different kind of services to the Haitian community. For instance, we have a service on blindness prevention. In Haiti, we have what we call a CNPC, the National Committee for Blindness Prevention, in cooperation with SHA, with the Ministry of Health, and also the Haitian Society of Ophthalmologists.
SHA came into being in 1952 and became a member of CCB 30 years ago. Community-based rehabilitation is one of the services offered.
About 11 RFOs, rehabilitation field officials, and also we work in the area of inclusive education. For instance, last year we have been able to help about 138 blind students.
Jean-Marc Monsiguer is an itinerant teacher in Haiti. He works in collaboration with others in Haiti's school system. He spoke with us through an interpreter.
He's talking about like the coach, the kids. He makes sure he's there with them to make sure they went to school, and then he makes sure like he supervises like the institution to make sure they do what they're supposed to do.
After the earthquake, did your role increase in any way?
He said because of the earthquake, a lot of establishments collapsed, and then like it's not like a lot of work, but it's more difficult because like they got other places. He has to go over here or go over there. There's more kids who are interested to go to school, and he's so happy because of that, and then that encourages him to do more work because like the kids want to move on.
The earthquake was also a devastating event for SHA. Its headquarters in the capital was destroyed, and the organization was forced to move its operations to another location, but the scale of activities was significantly reduced. One of the highlights of this visit was the opening of the new headquarters. It was a morning of giving thanks, but it was also an emotional occasion for many.
With the support of AAR Japan, Association for Health, for Aid and Relief, we have been able to rebuild the SHA's office. We received support from CCB, Site 7, from CBN, you know, and during those past 2 years, we have been able to help more than 3,000 people affected by the earthquake. But for the future, we want to develop different kind of services. For instance, with the support of CCB, we want to have what we call a lab to produce eyeglasses, you know, in order to support people who are economically weak. People
with over 3,000 active members and operations in 8 of the 9 administrative departments of Haiti, SHA continues to strive, and along with the Caribbean Council for the Blind, the mission continues, that of preventing blindness and visual impairment while restoring sight and creating opportunities for persons whose sight cannot be restored.